All right, today we're going to get into the story of a real character in the world of medicine. You could think of it as a highly specialized agent, one with a very unique set of skills and a very particular set of risks. Its name, Minocycline.
And this question, right here, gets to the very heart of why it's so fascinating. I mean, how can a single antibiotic be the go-to for something as common as acne, but also a weapon against a superbug like MRSA, and even be used for a tricky infection like Lyme disease? It's that incredible versatility that makes it so compelling. So, let's dive in.
So let's open up the file on our specialist. What exactly is minocycline anyway?
Well, at its core, it belongs to the tetracycline family of antibiotics, but you should really think of it as a custom-built, high-performance model. It's semi-synthetic, which means scientists took the original blueprint and gave it some serious upgrades, chemically tweaking it to be more powerful and more effective.
And here is its secret weapon. Its superpower, really. It's highly fat-soluble. Now, why does that matter? Because it means minocycline can go places other antibiotics just can't. It can slip past defenses and get deep into tough-to-reach tissues. We're talking deep into the skin, the prostate, and it can even get into the brain.
Okay, so it can get to where it needs to go, but what does it do when it gets there? What's its game plan for neutralizing the threat?
Its whole strategy is basically a sabotage mission. First, it sneaks inside the bacterial cell. Once it's in, it goes straight for the ribosome, which is pretty much the bacterium's protein factory. It latches onto a key part of that machinery and just gums up the works, bringing the entire assembly line to a grinding halt. No more proteins, no more bacteria.
So this is a really key point. Minocycline is what we call bacteriostatic. It doesn't just drop a bomb and kill all the bacteria outright. Instead, it plays it smart. It cuts off their ability to grow and multiply. This gives your body's own immune system the upper hand it needs to come in and clean up the now weakened invaders.
So with this really unique skill set, what kind of assignments does minocycline usually get? Let's take a look at its pretty impressive resume.
Its mission list is just incredibly diverse. A lot of people know it as a top treatment for really tough inflammatory acne. But it's also sent in for respiratory infections, skin infections, and it can even take on some nasty strains of the superbug MRSA. Its portfolio also includes things like chlamydia and even some really serious tick-borne illnesses like Rocky Mountain spotted fever.
But hang on, this is where the plot thickens. Minocycline has a hidden talent. It's not just about killing bacteria, it also has some potent anti-inflammatory properties. And because of that, it's sometimes used for totally different missions, like helping with rheumatoid arthritis. And get this, researchers are even looking at it as a potential neuroprotective agent in diseases like MS and Parkinson's. Now, that's still pretty experimental, but it's fascinating stuff.
You know, every powerful specialist has a bit of a dark side, a unique set of risks that come with those special abilities. And minocycline, well, it's definitely no exception.
So its risk profile kind of has two sides. On one hand, you have the more common side effects that are usually manageable. Dizziness and vertigo, for instance, are known to happen more often with minocycline than its relatives. But then you have the other side of the coin, the serious though much less common risks. And these are the big ones. Things like autoimmune syndromes, a dangerous increase in pressure inside the skull, and even severe, life-threatening skin reactions.
And then there is its signature side effect, the one you won't forget. With long-term use, minocycline can literally leave its mark. A very distinct slate gray or blue-black staining on the skin, teeth, and even in the bones. It's like the drug's unique calling card, and yeah, it can be permanent. Now, because of these risks, especially to developing bodies, there are some hard and fast rules. It absolutely should not be used during pregnancy, while breastfeeding, or in any kids under 8 years old. And the reason is super important. It can actually bind to the calcium in developing teeth and bones, which can cause that permanent staining and potentially mess with their growth.
So when you put this all together, what really is the minocycline difference? What makes it stand out from the rest of its antibiotic family?
It really comes down to a series of trade-offs. You see, minocycline gives you that superior tissue penetration, and it's often more effective against MRSA. That's the upside. But the risk, the downside, is a higher chance of dizziness and vertigo, plus that really unique, possibly permanent skin discoloration that you just don't see with the others. It's the classic high-risk, high-reward situation.
And that brings us right back to the central question, doesn't it? Minocycline is, without a doubt, a powerful and highly specialized tool. It can get the job done when other drugs fail. But with its very specific and sometimes permanent side effects, you always have to ask, in this particular case, is its special reward worth its special risk?
That's the tough calculation that doctors and their patients have to make together every single day.